Hi, my name is Nick, and this video is to introduce you to the concept of a patient activation liaison, a PAL. So a PAL is somebody who works with a patient to get them to be more engaged, to get them to start asking questions, to start desiring to accomplish goals, and to use a personal health record, which is a document that the patient owns and updates on their own to better manage and take care of their health and their life. The reason we have PALs and the reason that there are health coaches is this little area over here, this informed activated patient. So a PAL is someone who we intend to activate, not inform, a patient. So what does activation mean? It means someone who's a spark has gone off. They're starting to smile, they're starting to wonder, they're starting to ask questions. They're not just assuming a passive role when they engage in healthcare. And why is this needed? It's needed because to manage chronic disease and to prevent chronic illness, the solution is going to be those everyday choices that we make, whether we smoke or not smoke, whether we eat a healthy diet or eat junk food, whether we sit on the couch or get up and walk. So there's nothing we can do when a patient comes into the office that can influence their health as much as those little decisions that a person makes every day. And making somebody, or getting to a point where somebody is more activated, somebody is more wanting to become involved and wanting to make those health choices and wanting to make choices that allow them to fulfill their personal goals is a much more effective way of improving overall health than focusing on what we can do to someone in a 15-minute encounter by delivering information or medications. So the reason that the PALs work so well is that it is not very easy actually to get to the spark, to get to that point where a patient or a person is activated. If you ever been in healthcare on hospital rounds or in a clinic visit, you know that there's a lot of time pressure on doctors, on nurses, on nurse practitioners, on physician assistants, on medical assistants. Everybody in healthcare has a lot of time pressure, especially in primary care where there's such a demand for primary care. On the other hand, to change the way that people interact with healthcare, to actually get them to start thinking this is not just going to be an experience where I'm going to be subjected to other people telling me what to do and giving me advice and setting up goals for me, to actually reorient a person to their experience in healthcare takes a little time because they're not expecting it. And as a PAL, you'll see when you go into a hospital room and you're talking to a patient, it could take an hour for you and them to realize that you're actually there to uncover something that's important to them in their life and something that they want to accomplish. That's such a dramatic difference from what they've experienced, where teams run into the room, deliver advice, and leave, maybe criticize a little bit in the process. So patients are not expecting someone to actually sit down next to them and say, I want to try to figure out what is in your horizon, what is in your future in the next month that would get you really happy, that would fulfill you, that would be meaningful for you. What kind of goal could you accomplish? And I've got a set of tools here to help you accomplish that goal. So the point of all that is to get somebody to start to care, rather than being the object of all of these things that we're doing to them, to get them to start thinking, hey, this healthcare thing here, maybe it could do me some good. So for instance, maybe I didn't think about this during my admission for pneumonia, but maybe these doctors could help me with my hands. My hands hurt from arthritis, and I love to knit. And I haven't been able to knit for years because of my hand pain. If I could get one of these doctors to figure out how I can not have that pain when I knit, I would really enjoy that. I would really like to knit. So when you uncover those little goals that are so important to patients, what often happens is it leads them to start to wonder and to start to approach their relationships with their doctor, their nurses, their healthcare team in a way that is centered on their own personal goals and realizing those goals. And it can become transformational. So the impact really is that you're creating a spark in these patients. And the cool part about it is that if you're a volunteer doing this, there's virtually nothing that can be this exciting in a volunteer work, because you're in direct contact with another human being. You're connecting with them. You're learning these really awesome skills that you can take back with you. And if you are interested in healthcare, you will quickly lose any negative perspectives you might have brought with you about what patients are like or why they don't do what we say. But you'll begin to see that the problem is not so much the patient, it's the circumstances that exist where we're pressured to achieve our goals and quality as healthcare providers, and often has nothing to do with the patient's own interests, own desires, own hopes and wishes. And we often have very sort of incorrect notions about a patient's intelligence and a patient's abilities and a patient's experiences because we're so pressured to get our goals met and with them as our vehicle. So it really sort of humanizes the interaction that a human being can have with a patient, with another human being in the room, and can set you up to become a better healthcare provider. So in summary, this is training for a patient activation liaison PAL program. It's unique from being a coach or a health coach. You'll notice you're creating a spark, and you're going to have a lot of fun doing it. So hope you look forward to the training as much as I look forward to helping you become trained. Thank you.